and if you would just accept it on your end, you are more than welcome to keep your cameras off. And if you have any questions throughout the session, you are more than welcome to unmute yourself or put your questions in the chat box. Um, and yeah, so after this meeting concludes, you will receive your training log information. So you'll be able to access the needs portal. So be on the lookout for that in your email. Yeah, we'll just continue. So this is what today's training process is going to look like. We'll head over to the needs portal site and show you how to start a case in the needs portal as a caseworker. And from there, we will enter the family level information, the program terms information, and share the case with the service provider and a FPM. And then we'll switch roles back to the service provider and show you how to enter service dates and switch to the family peer mentor role and enter FPM notes. And then we'll switch back to the caseworker role and show you how to close out a case in Needs Portal. So as you all know, the Needs Portal is a web-based management information system that we use to make referrals and collect data for a higher start. It also functions as a resource referral system, so it helps connect families in need with social and behavioral health services. As you see, there are two aspects of the Needs Portal. The first piece is the information system. The management information system um, supports the collection of information about families involved within the child welfare system. And this can include assessments like UNCOPE, CTAC, and ACEs. And finally, this piece also helps track service dates and FPM contacts. So all the information that's entered in the news portal is used to evaluate the effectiveness of those community-based interventions. And then the second piece is the resource referral piece. So the resource referral piece of the needs portal allows caseworkers to refer individuals to FPMs and service providers for services. And so it serves as like a streamlined communication for all parties. This is an overview of kind of the flow of the needs portal. So it starts off with the caseworker creating a family in the needs portal. The family section is where you'll enter all of the SACWIS related information and demographics for each individual. So this information you already have. And the families tab will allow you to see the family's demographic information. But however, adding a family does not mean that they've been enrolled into a program. And so from there, the caseworker will then refer the family to a program and add all the participating family members to the program through the program terms page. And the program terms page allows you to actually enroll participants into START. So let's say if a participant has left, but at a later time wants to come back into START, they can be searched for and put back into the program terms. And the program terms section is where you will enter all of the START-related information. That includes the UNCOPE, ACEs, and CTAC assessments. And through the program terms page, a caseworker will then refer a participant to an FPM and to a service provider. So the caseworker has to first create the family, enroll them into a program, and then the FPM and service provider can enter their notes and their service dates. And then from there, the FPM or the service provider will either accept or deny the service referral. And then, as you know, the FPM has to log all of their contact visits with the family. And the caseworker, FPM, and service provider all have permission to enter service dates on accepted service referrals. So one of the users will enter the first 5 service dates in the service log, and this includes the assessment and the 4 sessions following that. And the first 5 dates are used for start timelines, and they're just important for calculating fidelity and start timelines. So within the needs portal, you can make referrals for a variety of services for families with which you work. The SED service referrals are required for all parents on the case, both custodial and non-custodial, so like primary and non-primary. And counseling service referrals are required for all children who receive a score of 4 or higher on the CTAC assessment. We know that not all counties have their service providers registered within the needs portal, but the system has a way to both make referrals to a provider with an account and a way to make sure those dates are entered when a provider doesn't have an account. And that's something that either the caseworker or the FPM can do. So for any parent participating in START, you will select the first 5 service categories shown here on the screen. We have counseling, inpatient, day treatment, intensive outpatient, and outpatient. And so, like I mentioned before, for service referrals, we're interested in entering the first 5 treatment dates. And again, those dates include the initial assessment and then the 4 treatment session dates after that. And obviously there could be more, but we will be calculating the first 5 treatment dates for fidelity. So as a reminder, documentation of service referrals and treatment dates for non-custodial parents is required within the needs portal. Some counties have expressed concerns about whether the inclusion of non-custodial parents may impact their data, but rest assured, we do want to see their interest in engaging with families. So certification for counties won't really include non-custodial parents. It will only include primary parents. As with the primary parent, you will complete the SCD service referral and when possible, the first 5 service dates. So for children who receive a service referral in instances when the child receives a CTAC trauma assessment of 4 or higher, for those children, you will select the service referral of individual/child. For FPM, they will enter notes on all their visits with families, which includes the date, the duration, who was present or absent, and any additional narrative notes. And as you know, visits are required to be done weekly, if possible. And in cases where the service provider isn't registered within the needs portal, the FPM or caseworkers are responsible for entering the 5 treatment dates we mentioned previously. We just find that it's easier for FPMs to do this because they are in more regular contact with the family, helping them with transportation. So that might be easier for them to do. So before we go over to the Needs Portal site, any questions before we do that? Okay. And all of this, the PowerPoint and any documents that I send over will be on the site, so you're able to download and access it as well. All right. Right, so this is the test site, and what I had just sent over was the data definitions. It's really helpful to kind of understand the fidelity indicators that the needs portal uses, just for reference purposes as well. You can keep that. And yeah, so this is the kind of like a test site that we use for training, but the real site is very similar. So as a caseworker, for those that are caseworkers, you will see this on your screen. And so what you will do when you want to add a family is you'll click on this Families tab, and you will go ahead and click on Add Family. And this information would be like auto-populated. So since I make accounts for everyone, this will already be filled out before you do that. So just for this purpose, we'll do like a fake family that's enrolled in START. So we'll do this out of, let's say, Clinton County. Your name will appear here, and you'll enter the SACWIS information and the SACWIS case type. The SACWIS open date, we'll do like a year ago. So we'll do like June 4th, 2025. And skipping that, and we'll enter in the service needs of the family. So we'll say like mom is in need of SCD counseling. It can be very brief. And then scrolling down, you will enter the individual's names. So we'll do first name, last initial. And this is mom, and you will check off if mom is the primary parent for this case. So yes. Mom's date of birth, mom's zip code, insurance, sex, and race and ethnicity. And if you happen to have that person's drug screen, you can always enter the drug screen in here, but it's not necessary as well. So it's just something that you could just an additional thing to add. And then you'll create the individual. So mom has been created, and then we'll add the next individual. So we'll do that, for example. All right, and then we'll create individual, and the next thing we'll do is add the child. All right, so we'll just have one child for this case. Obviously, if there are multiple children, do add more children. We'll just do one children for this scenario, and then we'll go ahead and click on save. And so once you do that, the needs portal will then like generate like family ID. It's just used within the site. We just use it to reference families. So family ID for that family. And then once you've done that, you'll see this blue button that says refer to Ohio Start. You'll click on that and you'll fill out the referral date, date of the first child welfare shared decision making meeting. And then you click on save. And then another ID that we just use to generate the ISOR ID, I think, the program ID. And then after that, you'll go ahead and add the individuals into start. So we'll do mom. And ignoring this for now, you'll just fill out the verbal agreement of when mom verbally agreed to participate. So we'll do, and then if you happen to know mom primary substances, you can fill that out as well, but not necessary. And then you'll click on save, and then mom has been enrolled into start, and then we'll do dad next. And then child, and then the child only has these questions to be filled out. So fill that out and home placement for the child currently. So we'll say that home placement is with dad. And yeah, everything has been filled out. Everyone is enrolled into start. So this is where you can fill out the assessments for each individual. So we'll do dad. Well, actually, we'll do mom. We'll do mom's UNCOPE assessment. We'll add UNCOPE. And I do recommend that caseworkers do this in the beginning so just so they don't forget. And so we'll do the UNCOPE assessment for mom. So let's say it's like, and no need to do anything with the score. You'll just go through and answer these questions for mom, and it'll just like generate a score for that person. And then it'll get kind of like a pop-up that says that that they will need a referral for services because they received a score of 3 or higher. And then we'll click on save. And usually it will on your end, it will show the score for the UNCOPE assessment, but just on this end, it doesn't really show that. But you will see a score for the UNCOPE assessment, and then you'll do the ACE questionnaire. The same thing. Filling these yes or no questions out for mom. And then we'll do the types of victimization assessment. And then this one is just checking all the applicable boxes for that individual. And then I know for hate crime and other, there is an option to like, explain it. And then the classification of that individual. So we'll say that mom is the above. And you'll click save. And then so mom's assessments have all been completed. And then you'll do the same thing for the other individual for dad, but just for the sake of training, I won't really go through the same assessment. But any questions before we move on? Okay. And then for the child, essentially the same thing. You do want to make sure that you're filling out the correct age group for the CTAC assessment. So the birthday is 2019, so they'll be around 6. So you'll see that like it'll give you the age. So you want to click out of that and click on ages 6 to 18. And then you'll click on add ages 6 to 18 CTAC, the date that it was given. And then same thing, I'm just going through answering these questions. And for these ones, obviously you can select multiple choices, multiple options. And there's an option for other where you can explain that as well. And so just going through and filling these out. And yeah, once you fill that out, the score will also it'll give you a score. So I can show you on, let's see, just so you get the score. Okay. Mm. It will give you the score. I think just for the test site, it doesn't, but Usually you'll get like a little green button with the number in it. And then the little exclamation points will disappear once you went through the assessment. The test site is a little wonky when it comes to that, but yeah, you will see the score on your end. And then the next one is the types of victimization. You'll add the types of victimization, and then you will enter the date. Same thing for the child, and then you'll click on save. And then, so we filled out the assessments for mom and the child, and then you'll just do that for all of the individuals within the family. And so any questions before we move forward?
Yes, I have a question.
Yes.
So, as far as the questionnaires, is it
Mhm.
only the case managers that are entering this information, or
Yes,
are FPMs doing it as well?
I believe it's only caseworkers that do it. They do have access. I think the FPMs also do have access to it, but I'm not sure if they really do that. But I guess I think they can do complete assessments, but I think it's mostly the caseworkers doing this. And obviously, like if there's some kind of agreement between the caseworker and family peer mentor, probably could be a possibility where they do complete the assessments, but I think it's just caseworkers. Yeah.
Okay,
Hmm.
thank you.
Yeah, of course. And then from there, this is where the caseworker will then refer the individuals out to the family peer mentor and the service provider. So we'll do the service provider first. So like family peer mentors won't be able to see the case on their end until they've been referred to them. So that's just something that the caseworkers have to do to keep in mind when they do do that. So you fill out the date of the service referral. So we'll do like July 1st, for example. The location, I think I chose like Clinton County. Service category. So we'll do this for mom. We'll do service referral for mom, and mom is in need of, we'll say, inpatient. And you do want to make sure for every service referral as a caseworker, you're only completing it for one individual. So you don't want to complete a service referral for two individuals. So we'll do select provider, and you can also filter out if you're looking for a provider in a specific county, for example. But most service providers don't have an account in the needs portal. So that's just something that you will have to figure out who will enter service dates. So what you can do with a provider that doesn't have an account is you'll click on provider missing. You'll fill out the name of the provider. So we'll say like it was Dr. I don't know, yeah, doctor provider. And you'll fill that name out, and then you'll click that it's for mom, check that off, and then you'll click on save. And so the service referral has been created, and you'll scroll down and you'll see that the service referral has been accepted since they don't have an account. And it's either up to the caseworker or the FPM to enter those service dates when you do have the document for those service dates, service logs. And so any questions about that before I move forward? Okay. And so if they do have an account in the needs portal, what you can do, we'll say this is for dad. Um, and so dad is in Clinton, I think, and then dad is in need of counseling, let's say. And then what you can do is you'll select provider, and obviously there is a list of providers that do have an account. And so what you can do is you'll find the provider through this list. And you can also search for their name as well. So we'll do test provider. We'll select that one. And so this is a provider that we've selected for this referral. We'll click on dad's name and we'll click on save. And so you'll get like a pop-up that says it's been sent to that provider. So then the provider will then receive an email, and then they can log into the needs portal and enter that service date, those service dates. And so yeah, next thing that we'll do is enter the mentor referral. So we'll add mentor referral and filling out the date the referral was made. And we'll share it with the appropriate mentor for this case. We'll find into this list. And this is for mom and dad. We'll click on save. And so, yeah, the mentor will then log into the needs portal and access that case. So they'll be able to see it on their end. And so, yeah, I will switch roles to the service provider and enter those service dates for dad. But any questions before I do that? Okay. And so I will go on the provider side of things. The service provider doesn't have too much to work with. They only have two tabs. So for those that do have an account, they will click on the accept/deny referrals tab. They'll see the referral made out. So this was the one I made out for dad, and I'll click accept. And then they'll go to the accepted service referrals, and then they'll click on service log, log service date, add contact log. And so this will be like, let's say the 2nd of July. Last year, this was not a missed appointment. The location was at the treatment facility, for example, and then we'll create contact. And then you'll keep doing that until there are 5 treatment dates that we're looking for. So this was the initial assessment, and then the second one was, let's say, like the next day. No, and yeah. And then once you have 5 service dates, that's when that's like essentially what we're looking for in the needs portal. And obviously there could be multiple referrals for that for the same individual. So if data was in need a different service referral, you can always make that service referral again and enter those 5 treatment dates. So yeah, it doesn't have to be just limited to like one service referral. So that is essentially the provider side of things. And then we'll switch roles to the mentor. So the family peer mentor is very similar to the caseworker side of things. So they do have the same tabs, but to access all of the mentor referrals, you will go to the all mentor referrals tab, and you'll see the one that I made out is currently waiting. So if you do need to deny, you have to have a reason for denial, but usually that doesn't happen. So we'll accept, and then we'll go to the accepted mentor referrals, and then you will find the family that you're looking for, contact log, and this is where you'll enter the contact visits. So log contact, and then you'll fill out the date of the first FPM meeting. So like the second, now how long it was, we'll say an hour and 30 minutes. The attendance record, so if it was like unsuccessful attempt, if it was a secondary contact, so if someone came on behalf of the family, if the caseworker was present, if a non-custodial parent was present, and who was present, who was late, who was invited yet failed to show up. So all that will be filled out. So we'll say mom, dad, and the child all were there. If it was an unannounced visit, so like if the family pre-mentor if they let the family know that they were coming, the method of contact, either in person or video call, and you'll just fill this information out, like where it took place, what was talked about, what the next steps are, and any additional narrative notes. So obviously this could be copied and pasted into like the notes that you might already have. And once you fill those notes out and you'll fill out this page, you'll go ahead and add a contact log. And yeah, so this is the first visit. And as you fill those visits in, it'll be kind of like a log of all of the contacts. So it could be like multiple pages as well. And then you can click on see more and you'll be able to see what you had just entered. And then this PDF version as well, you can click on that and you can download it and you'll be able to have a record of all of those visits that you've made with the family. So this is just for your records. You can download it and keep it for records. But obviously in the notes section, there will be more filled out. I just didn't enter anything in for notes, but you will see like the notes that you've put in there. So that's something that's really helpful. And then so that's how you would enter a contact log as an FPM. And then when you go to all service referrals, like I mentioned before, the FPM in this case can enter service dates for the family. So this was for dad. So that did have a service provider in the needs portal, but then for mom didn't have a service provider. And so what you can do as an FPM is log those service dates. So you'll do the same thing I did previously, log service date, add contact log. So this was like first, and let's say that it was a missed appointment. We'll say, yes, mom didn't show up. It was supposed to be at the treatment facility and you'll create contact. And then you'll do this 4 more times until there are 5 service dates in total. So this was for mom, but then this is how the FPM can also enter service dates. So yeah, it's just depending on if either the caseworker or FPM can wants to do that. So yeah. And then as an FPM, they do have access to all of um the cases that they are assigned to on the program terms tab and the families tab as well. So that's essentially very similar to the caseworker role. So, yep. Any questions? Okay. And so I will go back to the caseworker role, find the family. And so, yeah, I've shown how to make referrals to the service provider and FPM. how to enter service dates and contact visits. And as the caseworker, you can also keep track of what is going on with the case. So you do have access to all the contact logs as well, like what the FPM is entering, all the service logs. You do have access to view that as well. Um, all right, so the next thing that I want to do is I guess up at the top, the tabs that you're working with. So we do have a directory tab. So if you do want to like access to see who is registered and who has a needs portal account, you can access that as well and what their role is. And then we have a family lookup. So if you do need to find a family and you just can't find them, you can enter their family ID or their SACLIS case ID. And then we have a FAQ page. This FAQ page is really helpful in understanding how to navigate the news portal. So if you tend to forget what was talked about in today's meeting, you can download this quick guide that we've made. And so what this quick guide is it walks you through on how to add a drug screen, how to record assessments step by step. So it's really helpful in walking you through those steps. And so, yeah, we do have everything that you will need on this page. And then we have a very detailed user manual. I think we are updating it. And so that should be updated hopefully soon. And then we also have training videos on YouTube as well. So you can click on that and there are videos on how to navigate the site. And then that PowerPoint that I showed earlier will also be here that you can download. And you can always reach out to us at this email here. So this is communication from the news portal. I usually check it and I usually help people if they do have like specific questions. You can always reach out to us. And so that is the FAQ page. And then we also have a reports page. So the reports page is really helpful for I think caseworkers and supervisors. So when you click on to the timeline report, and usually it is filtered with like your county. So this is just like for OSU, since OSU manages the site. You will filter out by county and you can see a list of all the cases within the news portal. So they'll have their SACWIS case ID, the program ID, and all of the notes that all of the information that we collect basically. So if we have the date of the agreement, we have days to uncope. So all of this is calculated through specific like fidelity indicators. So um, we use this report description that you can download as well, and you can understand how everything is calculated. And so with anything that has an unknown basically means that information is missing for that individual. So you can always go back and check to enter in missing information. And then anything that has an NA is usually not applicable. So this is usually for a child. So the child doesn't have a start referral date. So this will be NA. But then for unknowns, you do want to go back and make sure that you're entering that missing information. And then anything in green is usually within the timeline that we're looking for, which is a good thing. And then anything that is in red usually means that it's out of that window of fidelity. So I think it's days to start referral should be 30. So it's 31 here. And then a negative is usually a date that was entered before the case actually was referred to start. And so, yeah, that is really helpful for, I think, supervisors mostly to understand where the data is, what the data is happening. And then we do have a drug screen report if you do tend to understand drug screen reports, but you can always filter out by like the minimum number of days you're looking at. So that is really helpful. And then, yeah, that's essentially it for those tabs up there. And then you can go back to the program terms page. And then if a person needs to unenroll, for example, which rarely happens, but if it does, you do want to speak with your, I guess, supervisors before you do that and reaching out to us. And then if I can't answer a question, it's always I would usually reach out to PCSAO on the clarification from them. So let's say that dad is just like not participating in START. So what you can usually do is click on edit and you'll click on unenrolled participant and you'll fill out the dad's participation like end of participation date. So we'll say like it'll be today, for example, and dad's reason for leaving. So we'll just say that dad, for example, his location is unknown, and then you'll fill out the add end questions. So these are the questions that you fill out when you're closing out a program. So for this one, you'll fill out the four areas and you do want to make sure that you're selecting at least two items in each of the four areas below. And this is something that caseworkers usually do. So when they close out a case, So for this one, you will fill out the evidence of absence. So if dad's location is unknown and he's been in START for about a year now, we'll say that, he attempted to gain sobriety, but, there are still some indicators that he needs to work on. So we'll select one under each area. And obviously this is like a fake family. And cases usually are in START for longer than this. And dad's sobriety is that he still continues to struggle. And how many months of sustained sobriety and early recovery did dad have a discharge? So we'll say about like 5 months. And if dad was involved in the MOUD, we'll say no. And we'll add the treatment modality. So dad was participating in, I think was it inpatient? Yeah, I think it was inpatient. Um, and you'll fill out the discharge status for dad. So dad was, we'll say, um, you dropped out of treatment, and then we'll create the modality, and then you can do that for multiple treatment referrals as well. So and then once you fill that out, you can go ahead and click on save, and then dad has now been unenrolled from START, so he essentially is not participating anymore, but the case is still ongoing for mom and the child. So and so and you can always add dad back into START if he does decide to come back. And so yeah. And so one thing I will do is close out the program. So we'll say that their case has, mom achieved sobriety, for example, you'll fill out the program close date. So dad, we'll say like yesterday, for example. Um, and the discharge reason. So we'll say that they completed their family case plan and they're closing their program involvement, the child placement. So we'll say that um they remained with mom. And so we'll do the same thing that we just did for dad. We'll fill out the participant exit questions. So we will fill out the participation, and then mom will say achieved indicators of early recovery. So we'll fill out all of these areas. And then her status regarding sobriety is that she achieved sobriety. And then if mom had any months if it's of sobriety, so we'll say about like 9 months. And then if they were involved in MOUD slash MAT, and we'll say no. And then we'll add the modality for treatment referrals. So completed. And then, yeah, adding those, if there are multiple treatment referrals, you can add that as well. And then since we already filled it out for dad, since dad ended participation, that won't need to be filled out, but it'll be displayed here. And then you will click on save. And so you'll see that it's been updated. And when you scroll down, this case has been closed in the news portal. And then when you go back to their family ID, you'll see that it's been closed. And then one thing that you want to make sure is you want to close out, enter the SACWA's close date. And usually the SACWA's close date and the program close date might not be on the same day. They might be on different dates. So you want to click on edit and enter that SACWA's close date. So we'll say like the same date, for example, and then click on save. And then it's been updated, so it's officially been closed in the news portal. Let's say that they want to come back into start. So you do want to make sure that you are using the same SACWA's ID because they want to be attached to the same SACWA's ID. You don't want to create like a whole new case with the same SACWA's ID. So they'll be coming in for the second cycle. So what you'll do is you'll find the family and you'll click on refer to Ohio Start. You'll click on that and you'll just fill out the same thing that we did in the beginning, start the process again. And so that way they'll be attached to the same SACWA's ID, but just like different program term IDs. So that's just one way to differentiate between that. And then when you go back to program terms, you'll see that the family disappeared. They were from Clinton County. So what you'll do is you'll click on filter results. The needs portal kind of like hides families that have been closed. So what you'll have to do is click on filter results and you'll click on true for both of these for closed cases, and then click on apply, and then that family will just show back up again. So it's only for closed cases. All active cases will still be displayed on your screen. It's just closed cases are kind of hidden. Um, and so you'll find that family again. And then, yeah, if you do want to like look back at it, they'll be stored here. And then that's essentially how to close out a case. Um, but yeah, any questions about that? All right. So I think I've added everything. I mean, I've talked about everything. And if there are like specific questions, if you know a caseworker has left the county and a new caseworker is being assigned, we can always change that caseworker on our end. If you forgot your password, we can also do that as well. And yeah, one other thing I do want to show is the dashboard. I believe that this will still be updated. I know that OSU will no longer be with Ohio Start, but I know some other organizations taking over, but I do think that this will be updated periodically, I believe. I'm not sure. But this is updated as of June 1st. So all the data will be displayed here. Essentially, what is on the needs portal is just in a visual for people and for counties to look at. And then for counties that have data for less than like 10 cases, I believe, it's just suppressed because of like privacy. And then when it comes to the for parents and adults, all the information will just be displayed here, like number of individuals. And then if you do want to like zone in on a county, you can see that as well, and then FPM contacts, and then program closures. So all the information is just here in a more visual and more for people to kind of understand where the data is coming from and what we're doing with the data. So you can always reference this. And then we also have just this dashboard that we use for Ohio Start. And yeah, I will put that in the chat. And we do have office hours. Our last office hour is the fourth Monday of the month. So next Monday from 9:30 to 10:30. If you do have any questions, you can always stop by and ask them for that hour. And again, this YouTube page that we have is also on this dashboard as well. And yeah, that's about it, I think. But any questions, you can always feel free to unmute yourselves or ask it in the chat. All right. So hopefully by the end of the day, you should be able to get your login information. So just be on the lookout for that. All right. Thank you, everyone.
Thank
Thank
you.
you.
Thank you.
Thank you.